Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45, 50 minutes or so discussing some of the programs that are out there that help serve Medicare beneficiaries' extra needs. We did a webinar earlier today that spoke to what Medicare doesn't cover, and it kind of ties in hand with today's presentation. But today, we're looking at some things from a carrier's perspective and what product they have to offer that can make a difference when we speak to people that have specific needs that we can address. And so we've asked our friends from Ameritas to come on and visit with us. This presentation is being recorded. It will be made available on our website at premiersmi.com and on our YouTube channel as well. And additionally, your marketer, your agent success manager with Premier will have the detail for you as well. The presentation is meant to be applicable to agents with different levels of experience. So some of it may be a basic review for some of you. For some of you, it might be great brand new information. So we wanted to make you aware of that, however, from the outgo, so we can do a little bit of level set. And we do so across the presentation. You'll find in the software system a section for both questions and chat. We ask that you put your questions in the questions box, and we'll make certain that we address any of those that aren't covered through the course of the presentation, because we want you to have full value of the time that you spend with us here today. So as we start with one of our first level sets, let's talk about who Premier Marketing is. For those of you that might not be as aware of it as some others, we are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states. We act as an insurance wholesaler through independent insurance agents such as yourself, through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. And we do so through a full portfolio of product that is aimed at our target demographic. So you have the base Medicare programs that take care of the financial shortfall in the base medical needs of a beneficiary. So the Medicare Advantage, the Medicare Supplement, and standalone Part D programs are there for you. But we also offer life insurance and annuity products, including final expense life insurance and pre-need plans, and long and short-term care products and disability income programs and ancillary benefits, much as what we'll discuss today, that take care of specific needs of specific beneficiaries. So when you look at Medicare Advantage, a lot of the times folks will say, boy, you got a nice portfolio, the national carriers are there, the regionals are there, but why are you talking about that when we're talking about ancillary products? Well, even Medicare Advantage products, if they do offer benefits in certain areas, it may not be enough. And so we want to make certain that folks realize that. And if you're working with folks just with standalone Part D programs, that's generally an indication that they're either really tight with their budget, or they may have a Medicare supplement program. In each of those areas, we need to look at specific ancillary programs to help address their needs. You'll see on this listing, however, that normally these programs come as part of the MA contract that you have with the named carrier. A couple of exceptions. Mutual of Omaha is a separate contract. Clever RX is a standalone discount program and not a Part D drug plan. MedSups kind of addressed this earlier, a broad portfolio of products, but these are programs that generally don't offer any assistance in some of those ancillary areas. And if they do, they might be a small discount program. So these are great targets for the offerings that we speak to today. Then those are ancillary products with our friends from Ameritas. And so in each of these areas, you have the leaders in those product categories. And it gives us the opportunity to market a little differently because you have different constraints on these products than you do on the others. Easier to deal with, we'll put it that way. It does create an additional revenue flow for you and your agency, but most importantly, it addresses that specific need that your prospect and client has, and we're able then to accomplish one of our primary goals, and that, of course, is taking care of our customer. When we look at the Medicare market overall, you got that aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day, near exponential growth. Tempered a little bit by some things brought about for different reasons. Social Security full benefits rising to 67 has some people delaying accessing Medicare benefits. They're working longer, they like to work longer, whatever the reason may be. this number is tempered just a wee bit, but it's more than made up for by the folks that are under the age of 65 accessing Medicare benefits because of a disability. In each of these categories, we want to make certain we have the product to address that specific need. And when you look at ancillary products, well, pretty easy to see what those are generally moving forward. Huge numbers in the Medicare market. What we have today, however, when we speak to the ancillary products, it's a bigger market than this as well, because they apply to folks that may not be on Medicare. So they may not be part of that number, be it financially challenged or what. It's a broad market we look to take care of and address with whatever choice those folks happen to make as part of their base underlying coverages. And we want to make certain that we're properly communicating. So use of an acronym guide, this one off of CMS's website, well, it reminds us to define those acronyms so folks really understand what we're talking about, and in many cases limit the use of acronyms if we can, to make certain that the communication that we're having with our prospects and clients is clear and they're able to grasp what we are putting out to them. Another piece that comes into play with ancillary products, well, you're in the Medicare market, everybody talks about the election periods. They don't apply in this circumstance. The special election periods, the special election periods, they aren't part of it either, because these programs are not subject to lock-in. What it does, however, is we reach out to folks with these programs, we run across a number of people who have Medicare coverages that they haven't looked at year over year. The majority of people on Medicare don't. And so this is a great door opener as well, regardless of the base coverage and regardless of the tools that folks on Medicare aren't using. It gives us then that opportunity to reach out to this population and say, hey, there are some things that aren't covered by Medicare. I want to lay out some information for you on some things that you may critically need. In your Medicare and You book, boy, I didn't update that picture, did I? 2021, come on, John. However, you've got some holes in the coverage here that aren't covered by Medicare, and sometimes folks don't realize that. Let's address them moving forward, because base coverages for dental services under Medicare are greatly limited, and most of the people on Medicare don't have that dental coverage, and so they're missing out on some of the other things that dental coverage brings. A visit to a dentist might be a way that they identify some of the health needs that they have in play. But why don't folks visit a dentist? Main reason, cost. If we can limit that cost or help assuage a portion of it, we are helping our people access a needed benefit on a regular basis. And because we deal with certain carriers that are technically adept, we have the opportunity to deliver the information they need, either live or virtually. And our partner today, Ameritas, actually has an opportunity for you to have a presence on the World Wide Web through a microsite that's available to you through their organization without cost. And folks will shop. Deft Research, a number of the other organizations that do different things to determine what Medicare beneficiaries are or aren't doing, are telling us that many beneficiaries are shopping before they visit with an agent. So having a presence out on the web is a good way to increase our likelihood of having people enroll with us. And it gives us the opportunity for them to create a selling process that doesn't really involve you, unfortunately or fortunately. They'll go on your website, enroll. They're digitally savvy. They've been taught by the doctors and the specialists and the hospitals and the dentists and their faith-based community to access information, see presentations in that fashion, and you are apt to have some additional business come to you and you go, I didn't talk to that person, I need to reach out to them. Great way to do that and make certain that we're utilizing all the tools that are available to us. What this also does for us too is it drives up our retention. Studies show the more product you have in the house, less likely you are to lose them as a client. It doesn't matter what carrier it's with, it has to be with the same agent, and that's you. So let's look at these products with that in mind as well. So we've invited our friend with Ameritas. We have more than one friend in Ameritas. Don't mean to belittle that point, but our great friend Taylor Davis is on the presentation with us today. And at this point in time, I am going to turn control over to Taylor, and our regional managing director with Ameritas is going to come on and bestow us with some wisdom when it comes to these programs. Taylor, the helmet is yours.
John. Oh, thank you so much. I appreciate the intro, and just you cover just great information at the beginning of that presentation. One thing I do before I probably forget when we go through this presentation, you talked a lot about MA and Medicare and all that stuff and Medicaid. But if you do focus in that MA area, we do not coordinate benefits. So even if that MA carrier does have some sort of dental benefit attached on that MA policy, you can have Ameritas too, and we'll always pay as the primary. I think a lot of the times when I'm going through this webinar, I forget to mention that, and that is a hot topic, especially today when we're going through these products. So I wanted to make sure I mentioned that before getting into the webinar itself. So if you're not familiar with Ameritas, we're going to cover it at the beginning like you've never heard of Ameritas before. I want to tell you a little bit about us, what's new here at Ameritas, some of the new features that we've launched, whether it's the end of 2022 or things that we're looking here on the horizon for 2023 as well. We'll be going over the product overview, all three of our plans, Prime Star Total, Prime Star Access, and Prime Star Value. If you're not familiar with Ameritas, one of the things that we're known for is having no waiting periods. So primarily, a lot of the times when you look at a dental policy, you have 6, 12, 18 months until major services kick in. Here at Ameritas, 2 out of 3 of our plans, major services kick in as soon as tomorrow, if you have an effective date tomorrow. So no waiting periods. We have credit for prior coverage, which we launched end of last year, September-ish of last year, we launched credit for prior coverage. I'll go into that in a little bit more detail as well. Also, we focused a lot on 22 of how can we help you as an agent be more proactive when you're looking at your book of business. So we launched a new producer portal that now gives you that access to go in there and see your full book of business. You can see cancellations, you can see lapses, you can even order ID cards for clients. There's just a lot of things that you can do now on the producer portal, which we launched end of last year as well. So I'll cover that. And one of the most important things that I like to cover, especially with ancillary products, is that enrollment process itself. I wouldn't consider our enrollment process an e-app per se, definitely not a paper app. But what happens is once you do get contracted with us through Premier to write Ameritas, you get a personalized hyperlink. That's how you quote, that's how you enroll. We don't ask for a social security number. We don't ask for an e-signature, and we take credit card and EFT. Just a very, very seamless process, which again, I'll go over at the end of this webinar. So a little bit about Ameritas. Who is Ameritas? What do we do? About 75% of our business is dental and vision. So that kind of gives you an idea that our focus here at Ameritas is dental and vision. Been doing it for a long time. We're both in the group and individual space. We have a life side, we have a 401k, and we have a retirement division as well. Our biggest division is dental and vision. And one of the big things which you don't see in today's market is a carrier that focuses on dental and vision. We don't have a Medicare product. We don't have MedSup, MA. We don't have any of those. So our focus, especially in that senior market, is dental and vision. Now, I will say maybe 50% of your time spent in the over 65, 50% maybe in the under 65. All 3 of our products are 18 and older with no max age. We are also in all 50 states. We do have a handful of state specifics, the 2 largest being Washington and New York. If you do focus in either one of those states, check out our website. I'm not going to dive into those products today, but they'll be on there. New York, a little bit different than the products I'll be going over today. Washington, just a totally different product. So if you do sell in Washington, take a look at our website and kind of go through there or reach out to us at the end of this. Premier knows all of the information as well. Something else I want to touch on, which I call Product 1A and Network 1B. I think both are very, very important in dental and vision, with product being, definitely the one that you need to look at first, co-insurance, no waiting periods, next day effective dates, but network is that second thing. We have one of the largest networks in the industry today. And with our negotiated rates, we're anywhere from 25 to 50% with an average of about 31%. So, yes, coinsurance is great, no waiting periods, but also the client goes in network, just adds that additional economic value for the client by going in network and having those additional savings. Product innovation, as we go through these plans, you'll see that we have a plan that offers LASIK, a plan that offers teeth whitening. We have a hearing benefit. We have increasing maximums. We have a cool new feature called Preventive Plus, which I'll go over here in a little bit. But we do look at our plans every year and think of new ways to kind of reinvent the wheel on dental and vision. We hear feedback from you. We hear feedback from clients on what they'd really love to see in a plan, whether that's higher maximums, or they'd like to see LASIK, which we added, or a hearing benefit, or just all sorts of things that are thrown our way. We want to include those in our product. So you'll kind of see every year we will switch up the plans just a tad. Last year, we didn't make a lot of changes to the product itself, but we added credit for prior coverage, which again, I'll go over here in just a little bit. This year on the horizon, we're looking to increase the maximums on one of our plans. So we're definitely hearing feedback. We're still always the number one product out there when it comes to dental and vision policies. But I always say there's no way that we can just be happy with what we have. We have to continue to reinvent the wheel when you're talking about dental and vision. And on that note, actually on Forbes, we were rated the best dental insurance for seniors in 2023. This is a Forbes article. I can send it over to John after this and be sent out. But it goes over all the individual dental policies out there. And Ameritas, primarily PrimeStar Total, was rated number one for seniors in 2023. So back to the focus, back to Ameritas on what we do with our products, how we reinvent everything that we do here at Ameritas when it comes to dental and vision. There's a big thing that we do focus on, and that's product simplicity. As we all know with ancillary plans, we don't want to have it long and drawn out process that says, okay, here's 15 plans. Let's go through each one of these. That's why we do offer 3 plans. We have a high, medium, low plan. So it kind of already gives the idea of, okay, I need a higher max, so I'm going to go to this plan. Or, hey, I have a child that I need child ortho for. Or, hey, my budget's more in that $18 to $20 range. PrimeStar Value might be a good plan. So it's kind of a 3-tiered aspect that, hey, you can already focus in on one plan by just having, a 1-minute conversation with a client on what their dental needs are. Ease of enrollment, I'll be going over a ton of that here in just a little bit. Member value, again, back to network, back to after even having the policy, what they have when it comes to the member portal, checking in-network rates, checking out-of-network rates, all the stuff that they can do on the tip of their fingers here at Ameritas. We do cover implants day one. Again, unheard of already to have no waiting periods. We cover dentures, everything under the sun when you're talking about major coinsurance. We also cover implants. So remember that as well. Teeth whitening, LASIK, and Preventive Plus are just a few new features that we launched end of last year. Enrollment, we'll go over that here in just a little bit. Next day benefits, you can have a next day effective date, or you can go 90 days out as well. Again, I want to mention, we are 18 and older with no max age. We are zip code rated. We're not age rated. So if someone's 18 years old and someone's 100 years old, they're going to have the same rate if they're in the same zip code. So honing in on network, as I mentioned before, product 1A, network 1B. And we do have a great website that you can go to and look at all of our in-network providers, dentalnetwork.ameritas.com. Again, I'll say that here in just a little bit as well, dentalnetwork.ameritas.com. That'll take you to the main website where you, as an agent or a client, can type in a zip code, county, state, and see who is in the network in a 5, 10, 50, I think it all goes all the way to a 100-mile radius to see how many providers are nearby. So right now we're hovering around 582,000 access points with 131,000 providers nationwide. Last I read, there's about 185,000 providers nationwide. So it just kind of tells you how large our network is. We do have providers down in Mexico as well. I think there's about 150 currently in Mexico. We could be hovering more towards that 200. Also, back to savings or negotiated rates are anywhere from 25 to 50%. Right now, we're averaging about 31% on those negotiated rates. So what that means is we partner with providers who, on an average for dental procedures, gives a 31% negotiated rate. So again, you see how large our network is. Could we probably have 100% of the providers out there? Of course, but we want to partner with those providers who give the best negotiated rates, who we can talk to say, okay, yeah, you're going to give a 30% negotiated rate on an implant. You're going to give a 25% negotiated rate on a crown. So we want to talk to those providers on having high negotiated rates, just to, again, add more economic value for that client who goes to an in-network provider. On the vision side of things, we have IMED and VSP. What it really boils down to on vision is where are they used to going, benefit frequencies, and what's their budget. We'll go over the plans here in just a little bit, but just remember those three questions: where are they used to going, benefit frequencies, and what's their budget. Member flexibility on both dental and vision. Member flexibility on dental, they can go in or out of network. Okay. The co-insurance on PrimeStar Access does change if a client goes out of network. On PrimeStar Total and PrimeStar Value, the co-insurances do not change if a client goes out of network. So keep that in mind as we go through the plans as well. On the vision aspect of member flexibility, at that point of enrollment, a client can choose whether they want IMED or VSP. So it's a great thing when you purchase an Ameritas dental plan, you're not locked into only having a VSP vision plan or only having an IMED plan. They can choose at that point of enrollment if they want IMED or VSP. Now, again, both are standalone plans. So if they want just dental or if they just want vision, that's great. If they want both, fantastic. So dental overview, no waiting periods on 2 out of 3 of our plans. PrimeStar Access and PrimeStar Total have no waiting periods. Again, product simplicity and credit for prior coverage. Want to dig more into that credit for prior coverage. We've had it for about seven months now. It's been a great asset to have for everyone's client, whether they're coming off of a group plan or another individual plan. We'll give them year 2 co-insurance benefits. Now that previous policy needs to be active for at least 12 months with no longer than a 60-day grace period. So if you're talking to a client today, say they retired and they retired 30 days ago, they were on a group plan for X amount of years, they qualify for credit for prior coverage. They'll get year 2 co-insurance benefits. Now, if you're talking to a client who says, I retired 2 years ago, I've never had dental insurance, but I had it, 2 years ago for a long time. Well, they don't qualify because there's a longer than a 60-day grace period from having that previous dental to moving over to Ameritas. So again, how they qualify: 12 months of prior coverage, no longer than 60-day grace period. And we only ask for 3 simple questions. We're not going to ask you to submit anything to us. You don't have to submit an ID card or proof of coverage. If you're helping them enroll or they're enrolling themselves, what we ask is who was the previous carrier, policy number of that previous carrier, and the termination date of that previous carrier. That's it. We're not asking them to submit anything to us, fax, email, nothing over to us. Just during that enrollment process, which is already seamless to begin with, we're just asking, are you replacing current insurance? Yes. Those 3 questions: previous carrier, previous policy number, and termination date as well. So what's going to happen is once they do put in that information, their benefits are automatically going to increase to year 2 co-insurance benefits. So to give you an example on that with PrimeStar Total, which I'll go over next, PrimeStar Total day 1 benefits is $180.20. That's day 1 on the co-insurance. So 100 preventive, 80 for basic, and 20 for major. Year 2 is $190.50. So if they're coming off of another group, or if they're coming off of a group plan or another individual plan, their year 1 benefits are going to be $190.50 if they're coming off of that previous insurance. So it's a huge benefit for the client. So going into our products, again, we have 3 product portfolio: PrimeStar Total, PrimeStar Access, and PrimeStar Value. PrimeStar Total will be our highest tiered product, our quote unquote most expensive plan. PrimeStar Access will be middle. PrimeStar Value will be the most cost-effective plan. So with PrimeStar Total, what you're looking at on dental max benefit, $2,000 day 1 jumps up to $2,500 in year 2. Preventive Plus, what Preventive Plus means is preventive services do not go towards the max benefit. So to give you an example of that, say the client purchases the plan today, tomorrow they go in and they get an exam. and let's just say that exam costs $120. Well, we're going to pay 100% of that exam, but that $120 does not go towards the $2,000 max benefit. So that $2,000 max benefit is just for basic and major services. That's a huge savings, right? That $2,000 is just for basic and major. Deductible, $0 for preventive, $50 for basic and major services. Mentioned before, preventive is covered at 100% day one. Basic, filling, simple extractions, 80% day one, jumps up to 90% in year two. Major, gum disease, crowns, bridges, dentures, and even implants are covered at 20% day one, jumps up to 50% in year two. So 180-20 day one, 190-50 in year two, so on policy anniversary. Back to that credit for power coverage conversation. If someone's coming off of a group plan or another individual plan that's been active for the past 12 months with no longer than a 60-day grace period, their day one benefits are going to be 190-50. Annual hearing exam benefit automatically built into the PrimeStar total plan, $75 for the exam, no network, just go wherever they want, submit the claim to us, we'll pay up to $75. Hearing aid benefit per ear, $200 day one, $300 in year two, $400 in years 3+. With PrimeStar Total, again, it's 18 and older. We do see more seniors going towards the PrimeStar Total plan just because of that hearing exam benefit and those maximum benefits as well. But again, it is 18 and older, no max age. PrimeStar Access, so seniors kind of go towards the PrimeStar Total plan. We see a lot of like the 35 to 55 going towards the PrimeStar Access plan because we do have that child ortho, we have teeth whitening, we have LASIK on this plan. But some of the differences you already see is with the PrimeStar Total, a client can go in or out of network and the coinsurances do not change. With PrimeStar Access, they go out of network, those coinsurances do drop a little bit. So keep that in mind. So PrimeStar Access starts at a $1,000 day one on the dental max benefit, jumps to $2,000 in year two. Preventive Plus is also included with this plan as well. Deductible, $0 for preventive, $50 for basic and major services. Again, another difference between PrimeStar Total and PrimeStar Access, we see more of the younger generation going towards the PrimeStar Access plan. So we do offer bite-wing x-rays, fluoride sealants, and space maintainers. They do have dependents who need that. Preventive covered at 100% day one, and you'll see the out-of-network coinsurance right underneath that. For basic, it's covered at 65% day one, jumps up to 80% in year two. Major, covered at 20% day one, goes to 50% in year two. Something else I'll point out is on major with PrimeStar Access, we do cover teeth whitening. We do not cover teeth whitening on PrimeStar Total with PrimeStar Value, the other plan I'll be going over here in just a little bit. CPC, credit for prior coverage. Someone coming off of another plan, day one benefits would be 180-50. But again, no matter what, if they're not coming off of a plan, they still have no waiting periods. Child ortho under age 19, we start off at 15% day one, jumps up to 50% in year two, lifetime max per person of 1,000. So if they have 3 dependents, each one of those dependents lifetime max of 1,000. A unique feature on this plan is LASIK. We added LASIK onto this plan last year. $125 per eye, years 1 and 2, $250 in years 3+. And that is per eye for the LASIK. And again, just automatically built into the plan. Just like PrimeStar Total, this plan is also 18 and older with no max age. Of course, dependents can be under the age of 18. PrimeStar Value, again, this is our most cost-effective plan. So just to throw some numbers out again, we're zip code rated. On average, on PrimeStar Total, you're looking at that maybe 49 to 55 range. PrimeStar Access, you're looking in that 40 to 49 range. And then PrimeStar Value, you're looking in that $18 to $25 range, depending on where they're located. So with Dental Max benefit, $750. Preventive Plus is also included on this cost-effective plan as well. Deductible, same as the other two. $0 for preventive, $50 for basic and major services. Preventive is covered at 90% day one, jumps up to 100% in year two. Basic covered at 50% day one, jumps up to 80% in year two. PrimeStar Value, unlike our other two plans, does have a waiting period, goes to 15% in year two. But with a cost-effective plan and someone's budget is in that $20 range, and they're coming off of another plan that's been active for 12 months, their day one benefits are going to be $180.15 for a low-cost, cost-effective plan. So keep that in mind as well. One thing I love to show during these webinars is really how the product works from start to finish. I think it's a good process to look at. You can actually print this off on our marketing website. It's a client-facing material as well. And it really just shows how our product works, whether you're looking at preventive, basic, or major services. For time purposes, we're going to focus on that light blue column, which is our major services. What we also have access to, or what you have access to, and the client has access to, is a dental cost estimator. So you can go on there, the client can go on there and say, type in their zip code and see what the average cost is for any dental procedure out there, all the way from an exam to implants. And you can see what that average is in a specific zip code. That's exactly what I did here. This is actually a Minnesota zip code. I typed in the zip code and I said, okay, how much is a crown in this specific zip code? Well, in this zip code, it's about $1,400 to get a crown. So where does this play a part into the Ameritas plan? Back to the first thing I said, product 1A, network 1B. They go in network, there's an additional savings. We're averaging about 31%. Again, when we partner with providers, they're giving negotiated rates anywhere from 25 to 50%. Our average is about 31%. So say the client purchases a Prime Star Total plan and they go as soon as tomorrow to get the crown. They go in network and they have that 20% coinsurance day one. So take the $1,368 and on average with the negotiated rates, times it by 31%. Comes out to $803. So without even talking about the product itself, co-insurances, all that great stuff with our plan, just by going in network, you're saving that client $600. Now take that 803, multiply by 20%, 642. That's a day one savings of 53%. So yes, as we go through the products, 20% day one, no waiting periods, all that great stuff. 20% is a great co-insurance, right? With no waiting periods, all that stuff. But if they go in network, that's an additional savings of 53%. Just a great savings across the board. Now, let's say they don't need crown until year two. Year two is 50% co-insurance. So take 803, multiply by 50%, 402. So whichever way you look at it, 53% savings day one, 71% savings in year two. You're adding that value to the client by one, having the product, and two, by going in network. That's why we have it right there on the website on how you can search for in-network providers, because it saves a ton of money for that client to go in network. Back to credit for prior coverage. Say you're talking to a client, they're coming off of a plan, another plan, and they get year two benefits day one because they get that credit for prior coverage. That could be a day one savings of 71% because it's taking that 50% co-insurance day one. So switching gears to vision, of course, vision, no waiting periods. And as mentioned before, they're both standalone. Dental and vision are standalone plan. And we had that member flexibility at that point of enrollment that the client can choose either IMED or VSP. VSP is going to be a little bit more expensive than IMED, just over $16. IMED is just over $10.50. VSP, great name recognition, Costco, Vision Works, Walmart, Sam's Club. Now, when I go through VSP, you'll kind of see, okay, it's a little bit more expensive, but back to those three questions that I mentioned before, right? Where they used to go in, benefit frequencies, and what's their budget, right? So if they're used to going to Costco, well, they're probably going to stick with VSP. If they're used to going to Pearl Vision or somewhere else like that, IMED might be the way to go, right? Because they're used to going there. Maybe it gets knocked out with budget. Their budget's more in that $10 range. Well, then IMED might be the way to go. If they need eyeglass, lenses, contacts, and frames every year, well, then VSP will be the product for them. So with VSP, a little bit more expensive plan than IMED. It's once per year for everything. So an exam once a year, eyeglass, lenses, contacts, or frames once per year as well. A little bit more expensive plan. The exam deductible is going to be a little bit less than IMED. A VSP is a $10 deductible for an exam. Covered in full in-network. and a frame of contacts allowance is $150. Out of network really shouldn't play a part, right? Because at that point of enrollment, they're able to choose IMED or VSP. So they should know, well, I'm going to go with IMED because I've been going to this provider for X amount of years. I know they're in network. So that out of network coverage shouldn't play a part in it, but just know that there is that out of network coverage as well. Switching gears to IMED, again, a little bit less expensive than VSP at that just over $10.50 mark. Lens crafters, target optical, Pearl Vision. Again, benefit frequencies, budget, where they used to go in. IMED benefit frequencies once per year for an exam, but once every 2 years for eyeglass lenses, contacts, and frames. A little bit less expensive, a little bit higher on the deductible, $25 for that exam deductible. Covered in full, you'll see on the left-hand side lenses, single vision, bifocal, trifocal, $130 for that allowance on the IMED plan. VSP was $150, IMED's $130. So you can see those differences within the product itself. But again, ask those 3 questions: where they used to go in, benefit frequencies, and what's their budget. So mentioning 2022, what we've done, what we did for the agent support aspect of, viewing your book of business, being able to have real-time data. We launched a new producer portal. And again, it was, I believe, August maybe of last year is when we launched a new producer portal. If you haven't yet, if you're contracted with us today and you're like, my goodness, I had no idea that they launched a new producer portal, go on there, make a login, do your book of business. It's a great tool to have. If you're not contracted with us yet and you get contracted through Premier after this, make sure you go on there, get a login for your producer portal, and then you can start viewing your book of business once you start writing. Producerportal.ameritas.com is just the website you go to for that. The next thing that we did is we rolled out a marketing website. So everything I have, you now have. If you follow me on LinkedIn, we post about every few days on new things that we find beneficial for agents and clients on when it comes to dental insurance, whether it's through Medicaid or Medicare or some way we can weave in life insurance as well. There's just a lot of marketing information that we have on that agent marketing site, explore.ameritas.com/agent marketing. We have podcasts, all of our brochures, all of our flyers, the creating economic piece that I went over, the illustration that shows how our product works on there as well. Sales Connect team, I believe we're up to 10 people in the Sales Connect team. This is just for individual dental and vision. Sales Connect team can help you, the agent, also the client as well. Say the client calls you, they have questions about their policy, you got to jump to another appointment. Sales Connect can help them through that process. They have questions about provider search or literally anything and everything except 2 things. One, claims. They'll point the client in the right direction, but they can't, sit on the phone with them and go over claims. They'll go to the claims department for that. Secondly, they can't take any payment over the phone. Customer service can do that, but over the phone on Sales Connect, it cannot take a payment. So if a client calls you, says, hey, I need to change my payment. One, they can go into their member portal and change their payment. If they don't have access to a computer or don't want to log in, they can call customer service to make that payment as well. Sales Connect team just can't take the payment on the phone. Member support, as mentioned before, member portal, Ameritas.com. They can go on there and log in. That's where they can view their claims detail. They can view their policy documentation, ID cards, really anything they want on that member portal. They can change their credit card or EFT information as well. And also customer service can help them with everything. So back to the enrollment process. Again, once you do get contracted with us through Premier, you receive a personalized hyperlink. That's how you quote and that's how you enroll. You don't quote or enroll on your producer portal. The hyperlink is how you quote and enroll. The producer portal is just for viewing your block of business. So with this hyperlink, it's going to be on a welcome email. Once you get contracted with us, we send you a welcome email and you copy and paste that link into your URL. That's what you use. That's the only thing you use for quoting and enrollment. There's so many different ways to share this. Again, it's a personalized hyperlink for you. It looks exactly like our website, but it has your information on it. You can put this on social media. A cool feature that we've had agents do recently is make QR codes. So they make flyers, they'll put their QR code in it, they'll drop it off at dentist offices, and the dentist office can give the client the brochure. They can scan the QR code, and they can enroll right off of their phone if they want. They can call you, help them enroll, whatever it might be. Because again, we don't ask for an e-signature, no social, and we take credit card and EFT. Just a very, very simple process. Social media, great way to share it as well. Once you copy and paste the link into the post, it comes up with a picture. It's nice. They can click on it, and they can enroll themselves as well. Just recently, I think John probably knows this story as well. PNC agent was like, you know what? I've never offered dental and vision in my life. I have thousands of clients. I'm just going to email blast this hyperlink out to my clientele and say, got a great new dental and vision plan. Click the link to enroll yourself, or give me a call and I can help you enroll. I think in the first 48 hours, they had over 100 people enroll in dental and vision because they can enroll themselves. There's no back office login. We don't ask for a lot of information. Super, super simple when it comes to that. So it's as easy as just sending out that hyperlink that you receive from us. We are zip code rated, as I mentioned before, so we're not age rated. So the first question we're going to ask during the enrollment process is zip code. So this screenshot right here is exactly what your website looks like. Up in the top right-hand corner, you see that agent tab. That'll have your information on it. So every so often, make sure you're clicking that. And if it has our Sales Connect information on it, you're on the wrong link. It has to have your information on that agent tab. So we're going to ask for zip code. Do you need dental coverage? Do you need vision coverage? And how many need coverage? So dependents. How our pricing works is individual plus one, and family. So after 3 people, you're priced at the family mark. Dependents, I think we go all the way up to like 15. So we should cover every family out there, but we go to 15 dependents. So once they say yes, or if you're sitting across the table from them or on a Zoom call, whatever it might be, the next thing that's going to pop up are their dental plans. So exactly what I went over with PrimeStar Total, PrimeStar Access, and PrimeStar Value will show up on the screen. You can view plan details. So the screenshot that I had when I was going through the plans, it'll look exactly like that. You'll see your 2 co-insurance, the maximums, all that stuff will be on that view plan details. You can also compare the plans. So if you want to compare Total and Access, one covers LASIK, one doesn't, one has teeth whitening, one doesn't. You can compare the plans as well. Also, if a client says, just send me a quote and I'll take a look at it. Well, you'll do the zip code information. You'll choose if they want dental and vision coverage, how many need coverage, and you can just share that quote. They can enroll right off of that quote, right? Because it's coming from your hyperlink. You're sharing the quote, and they can just enroll themselves. It's very, very simple. So what's going to pop up first after you click the plans or they click the plans will be coverage effective date. Again, it's as soon as tomorrow, or you can go 90 days out. Email address, we will ask for an email address, but they don't have to have an email address. You can continue the enrollment process without an email address. We ask for an email address because they can receive their ID cards electronically. And also they get all their plan information electronically as well. So it just comes to them faster. ID cards or plan documents takes about 7 to 10 business days to get to them. So if they do have an effective date of tomorrow and they're like, I need this ID card now. Well, if they get it electronically, they're going to get it as soon as they hit submit, or they can go to their member portal and download their ID card as well. But if they don't have access to a computer or have an email address, their ID card is going to be about 7 to 10 business days. So you can continue without email, or have the email, applicant information, name, date of birth, gender, and that's about it when it comes to that. Dependents, if they have any, put their name and information there. Previous insurance, that's where that credit for prior coverage is going to come in. Again, if they've had previous insurance and are they replacing it? If they say yes, yes, type in the 3 questions I already mentioned before, where policy ID number, previous carrier, and termination date. They'll automatically receive year 2 co-insurance benefits. They review the documentation, review the products, make sure it's what they want. They'll see what's going to be deducted from their bank account or credit card. Hit submit, and that's as easy as it is. With the credit card, there's no credit card fee associated with it. Credit card, EFT, no e-signature. So once they hit yes on the agreements, hit submit, that's it. There's not going to be something that's sent to them. Please sign this to have your coverage effective. That's it. Once you hit submit, you're off to the races, good to go. That's all they need. Again, no social security number either. Back to that find a provider tool. Again, 1A, 1B. 1B is that network. Network's super important when you're looking at dental coverage. Again, we have that member flexibility of going in or out of network. But as we already talked about a lot throughout this webinar, is that extra value by going in network, that additional savings. Those negotiated rates are huge, 25 to 50%. So in the Find a Provider tool, you can use your hyperlink that you have up in the top right-hand corner. There's a Find a Provider tab, or you can go to dentalnetwork.ameritas.com, and it'll show Find a Provider search, city, county, state, or zip. Search whichever way you want. On that selected provider, it's going to be the classic PPO. That's it. That's all it is on the individual. I think there's two other options. The only one is classic PPO that you need to click. So what's going to pop up is once they or you hit in that zip code, county, state, or whatever you're looking at, it's going to be all of our in-network providers, all of them. So whether they're in green lettering or black lettering, they're in network. Now, the difference between the two is the ones in green, we want to say thank you to those providers for going above and beyond when you're talking about negotiated rates. So our average is 30%. They're going to be above average negotiated rates. So just keep that in mind. If a client says, you know what, I 100% want to be in the Ameritas network, I would probably hone in on one of the ones in green because they have more negotiated rates included with them. So again, I want to say thanks for taking time out of your day. I wanted to make it about 45 minutes, so I think we're right on there. And John, I imagine we might have questions. If not, you can maybe something there I missed. You can ask those as well.
Well, I don't have any questions from anyone viewing it except possibly for me, and that is,
go ahead.
When the policy is issued, what is the time frame for compensation? How quickly or slowly does an agent get paid?
Yeah, so we recently changed to weekly commissions. So if you have an effective date tomorrow and the draft was successfully paid tomorrow, then you'll get paid on Monday. So we pay weekly. We used to be, I'll be honest with you, we used to pay commissions monthly. That was another big change. Thanks, John, for bringing that up. Another big change that we did last year is move to weekly commission. So if it's successfully drafted, you'll get paid that following Monday.
That's awesome. And I think that's a really pertinent question for folks that are active in the Medicare space, most active in the Medicare space during AEP and are selling MA plans because they don't get paid until after the first of the year. So a great way to offer a demand product and make certain that it helps you with your budget. So that's awesome. All right, so at this point in time, I'm going to pull control back to me, finish up with just a few slides. Taylor, once again, thank you for the presentation. I learned quite a few things today, and I thank you for that. A few things that we do here at Premier that can help you. One, the contracting process, if it's done electronically, just goes so much more quickly and without hassle, and make certain that we do it correctly. When we work with Ameritas, we're going to do a direct link with that organization. And there are some things that you need to do on your end to make certain that the contracting goes through in a timely fashion. And it's as simple as going in and doing another click here, but that's the way it is. However, we do also make available to you through a software program, SureLC, Insurance Bay, whatever you want to call it, that gives you an opportunity to create an agent profile. So all the detail you need for contracting in the future with different carriers is there. In many cases, it's just a simple click to get the contracting in play with different organizations. But we want to make certain that we provide a way for you to store your information as well. We do offer discounted errors and admissions coverage for qualified agents. One, what's a qualified agent? Well, you got a contract with us. But two, this discounted errors and admissions piece is not adding you to a blanket E&O for just one policy. You own this program. At Premier, we're proud of our size, how big we are, and how we're everywhere, but we're not that big and not everywhere with every product. And we recognize that you may have relationships with other marketing organizations as well. Purchasing this program covers you regardless of whom you contract through. So we want to make certain that we take care of you in that area as well. And additionally, make discounted continuing education programs available to you through our relationship with WebCE. It gives you then that opportunity to make certain your license stays in play. And you do also have an opportunity through a modified guarantee issue process to pick up DI coverage, disability income coverage for yourself, and be paid a commission on it. So if you're looking at your own personal benefits package, we want to make certain that we cover all the bases there as well. I mentioned at the outset that today's presentation is being recorded and will be made available through our website and through our YouTube channel, but past presentations are available there as well. Access to them 24/7, a great way to make certain that you can take information that's been provided to us, in this particular case with Taylor, and the programs that they offer, and speak to dental coverage in centers of influence in the community, be it live or through a webinar. And we have a number of different programs that can help you in that space and making that part of your marketing program. I'd be remiss if I didn't speak to and pound this live horse on our Medicare Center program. And for those of you that are familiar with us, you understand that this is a system that enables you to access different quoting engines through a single login. You can provide side-by-side comparisons of plans and do so compliantly because you've collected the scope, you've recorded calls, all the things that the government in their infinite wisdom is asking of us as agents. It also provides that CRM, so you can go through and you can visit with people that you've done other business with and say, hey, I've got a great dental program, a series of great dental programs available to you, and I want to make certain that you're aware of them and that you have access to them. This program also offers that personal agent website, so you have a presence on the web. You dictate what information's on it. Someone enrolls in it. Well, hey, God bless you. You got another client. It is available as a mobile application. I'll speak to Lead Center later, but it also gives you information on, learning center resources. So you have detail in there where you can improve your own skill set. And that's important to us because I don't care how long you've been in the business, we can always be better. It is available once again as a mobile application, and as the inimitable JJ Walker says on TV commercials, it's free. So you don't have any cost associated with it. We do also offer a source of information for you to make certain that you're aware of all the compensation that's available to you. Periodically, programs outside of MA and PDP will offer incentives, and it may help you qualify for a trip with that carrier, and it may help you qualify for premier incentive programs. This will be taken behind the wall for some compliance pieces that are coming into play, but it gives you an opportunity to make certain that you are aware of all of your compensation that's coming to you. And that premier incentive program, well, hey, this past week, it was down into a Mexico cruise situation that was awesome from what I understand. We do also provide other lead programs available to you. If you want to smile and dial for dental, I think that's awesome, because one of the things you'll see is there's normally a rate increase between 64 and 65. You're able to fill your T65 funnel for the following fall, and you're calling about something that's not so repetitious. Some of the calls I take, and I take probably a dozen a day because I knocked off my robo-dialer stopper, whatever you want to call it. All those calls have a distinct purpose in mind. Talking about dental is something completely different, and their ineptitude may lead to success for you simply by snuggling up to it and running through it. As I mentioned before too, it's a great way for you to visit with other individuals through community-based programs. So marketing through the retail programs that are especially popular during the annual election period, but available throughout the year. Speaking through faith-based organizations to make people aware of the dental programs that are out there with Ameritas. And it's a great way for you, as Taylor kind of mentioned, to market with providers. You don't have some of the same pressure dealing with dentists that you do with primary care physicians or specialists. And it's an organization type of situation where they're going to appreciate your help. So something to consider there. There are carrier-generated leads available through association with different MA and PDP programs. The rest of these we'll talk about in detail in a second. The mail program, well, it's based on production. It drives down the cost so you can do things consistently. That's the trick to about any program and its success, is doing it successfully, and it's done through preferred lead vendors. We vet these organizations to make certain that the returns that they get on different pieces they send out that we have oversight on, we watch that as well, are handled back to you as quickly as possible and are as user-friendly as possible. So it helps you in that regard too. You do have the opportunity to access different direct mail programs as well. The cost will vary throughout the year. They've got a sale going on right now, as a matter of fact, but these are direct mail responses that have never been touched, and you can get some that are pretty fresh too. We do offer an internet lead programs through Facebook with this organization that gives us detail on final expense and Medicare leads. I would caution you with approach on any social media pieces in the fact that if they're clicking on it and want information, they want it quickly as well. It's a real microwave situation. So if you work the internet, we want to make certain that you're aware of the fact that, hey, we got to get that info out to people quickly. The T65 Locator is a great way for you also to take a free program and make it available to you, download it to your smart device. They'll check and see that you're contracted with us for different programs, and they'll kick back this information where you can set parameters and you can find out where people live that are in that situation. So we want to make certain that you're aware of this tool as well. Our referral program deals not only with the sales process, which is important to note that we start out with the initial conversation of looking through referrals and work through that sales situation. And if people buy or not, you may get additional leads from them. And as I mentioned before, it's a great way to access and engage your book of business by simple conversations that we noted before. All of this, however, is an opportunity for us to earn your business. We want your business. We want to be referable to you. And we do so through partnerships such as Ameritas that offer us such strong benefits and strong assistance to make it work for you. And it's simple. These programs do not require certification, so it's quick to get in the process, quick to add it to your marketing program, so you don't have the challenges of, oh my goodness, I got to do all these certs, I may not pass, how am I going to, contract, put it in your plan, sell it. That's the way it works. So all that said and done, until we are able to visit with you again, at this point in time, if you've worked with Premier in the past, I thank you for that business. We look forward to enriching that situation through our association with carriers such as Ameritas. For those of you that are just checking us out, thanks for the opportunity. We look forward to earning your business in the very near future. But across the board, if you've listened to this presentation, I want to thank you for the time that you've invested with us. It's very precious to us all, and I appreciate that expenditure of your most valuable asset with us. So, checking for questions. We are good. Taylor, once again, thank you for an awesome presentation. For everyone that's come on board, until we're able to visit with you again, we wish you good selling. Thanks so much. We'll talk to you soon.